Thank you for joining me and all of us here today for an update on Jacksonville's continued response to COVID-19. As I just announced, with me are local leaders from our local hospitals. By the way, each of who have been an invaluable resource to my team and to me personally over the last couple of months, both on formal organized calls and calls that I make in the morning, on the weekends, and in the evenings. They all each individually are willing to take my call and provide guidance and wisdom as we navigate these uncharted territories. The improvements that we've seen over the last month and weeks can be directly attributed to preventative and protective measures taken at state and local levels, and the personal measures Jacksonville citizens are taking to protect themselves and loved ones. By continuing these measures in the days and weeks ahead, that we will safely and responsibly reopen our city and our economy. While the medical community is working hard, the fact is we may not have a vaccine for this virus for quite some time, which means it's with us and will remain with us. If I'm in a grocery store or in a convenience store, or if I'm in an indoor facility where I'm going to be in close space, where I can't socially distance with people that I'm not normally around, which means I don't know where and who they interact with, I wear a mask. I do it because it not only protects me and my family, but it protects fellow citizens. And there's also extremes. I was jogging this weekend alone on a wide open, canopied area with nobody around, and a person was coming at a distance, walked by me and said, "Where's your mask?" Let's have common sense. I was outdoors in wide open space, but I reiterate, in public and close spaces, very strong recommendation to wear a mask and to be one city and one people together and not pass judgment on each other and try to force each other into behaviors.
We have a number of studies at our organization and across our entire UF enterprise where we're studying hydroxychloroquine, which you've heard about, but we continue to study it to see if there's any benefit. We look at serum, we look at data. So our goal as a research institution is to continue to try and discover. That being said, here's what we do know. The masks matter. If you and I don't have a mask on, the risk of transmission is high. If I have a mask on and you don't, the risk is moderate. If we both have a mask on in public space, the risk is low. So we want to continue to emphasize the value of a mask.
Good morning, everyone. My name is Doug Baer, CEO of Brooks Rehabilitation, and I'd just like to talk a little bit about this hospital collaboration that we have. At Brooks Rehabilitation, we serve patients from all of these facilities, but some of these organizations here compete with each other, but not during this pandemic. We've had a very unique collaboration where we've met and spoken by phone twice a week, and really to coordinate treatment of COVID patients, to share best practices and other information, research, and to really prepare for a surge in COVID patients, and so we could be well protected and coordinated as a city, and really avoid some of the practices that have occurred in other cities and other countries for that matter. And I think it's very unique, and I'm very proud of that. I'd also like to thank Mayor Curry. He's participated with us regularly and provided information to us. We've provided advice to him, and this press conference is another great example of that. I'd also like to thank specifically Mayo Clinic. A great example of this collaboration is Mayo's testing that's been rapid results, and volume testing has helped all of us to be able to test our patients and some of our employees and get results quickly so that we could treat these appropriately and also conserve the precious PPE resources.